This is part two regarding the male 61 years old, right lower lobe, large central mass, inseparable from mediastinal lymphadenopathy. First thing, initial step for T staging is the size. According to the size, we have a large mass exceeding 7 centimeters. Dislocate the T staging into T4. The staging is divided into, according to size, from 1 centimeter to less than 3 centimeters is type 1. From 3 centimeters to less than 5 centimeter is staging 2. If mass is 5 centimeters up to less than 7 centimeters, it is T3. We have other criteria that will identify or determine the T staging for the masses. We have 3 factors plus the tumor size. We have the endobronchial extension. We have the local invasion and presence of separate nodule or nodules. The diagram looks like complicated, but it makes our work easy, and I like this diagram. Let us explain the endobronchial extension. Any size of a mass involving the carina is considered T4, even the size if it is less than 7 centimeter. But if a mass is located and involving the main bronchus, either right or left, in our case, it is not involving the right main bronchus as we saw before. It was involving the bronchus intermedius. So according to this, so it is T1 according to the endobronchial extension. This T staging is upgraded by the size into T4. What if the mass is involving the main bronchus? It will be T2 staging. What about the other factors? Local invasion. If there is local invasion, like our case, we have great vessels invasion. We have right pulmonary artery invasion. This is considered T4. So according to size, we are T4. We are T4 according to local invasion. Our mass is T1 according to endobronchial extension. We consider the highest T staging according to our collective criteria. In our case, we don't have separate tumor nodules. So what if there is separate nodules? If the tumor is here, right here in upper lobe in this diagram, and the presence of nodule in the same lobe, this will render the staging T3. Presence of the nodule in the different lobe, lower if it is here, upper lobar, and the nodule is lower lobar, this is different lobe, so this will be considered T4. In our case, we don't have this C separate nodule, tumor nodules option. So in our case, we have T2, T4 staging for our case because of invasion of great vessel, like pulmonary artery, and because of the size. Let us go to this table. According to size, our case is more than 7 centimeters, so it is located in T4 staging. No bronchial, no extension of the bronchus, no extension proximally from lobar bronchus into a main bronchus. So we are placed in T1 according to the endobronchial extension or location. And here in the local invasion, our mass is resting for long distance. There is long mass pleura contact length exceeding 3 centimeters. This will cause that patient invasion. Pleural invasion is most likely, but no absolute CT criteria for invasion of the pleura, either visceral or parietal or chest wall, except damage or destruction of a rib. So this is not available in our case. So we will raise the possibility of invasion of the pleura, but we are sure because of encasement of the great vessels that we have involvement of the right pulmonary artery. So according to these two criteria, our staging is T4. And this was the end of the T staging as T4 for our case. Thanks for your attention.